Hello students, my name is Miss Wood and I'm your clinical instructor and I'm going to teach you today about starting an IV. So if you want to get out your checklist, we have a checklist, and it's initiate a peripheral venous access. So that's the checklist that we're going to go by. And the goal of that is to start a intravenous infusion using the sterile technique. And the first thing we're going to do in our checklist is to verify orders, okay? We're going to make sure that we verify our orders. So, and in order to verify your orders, you'll have a clipboard that looks like this, and you'll open it up. And on the inside, it says doctor's orders. And of course, you're going to check and see what you're going to have. And this says start an IV, 1,000 mils of normal saline to run over 8 hours. And you'll have to not only compare it to the MAR that will be underneath it, but actually calculate what the dose will be at the time that you use it, okay? So you'll also be looking for allergies. So make sure that if it doesn't have allergies, which this one doesn't have any allergies, you'll have to verify it with the patient or in the chart, okay? That if the patient has any allergies. Along with that, you'll need to clarify any inconsistencies. If then one of those inconsistencies was that there was no allergies, but also about if the patient is allergic to anything that we might be starting. So check the patient's chart for any allergies, and then we're going to wash our hands. Where's my stuff? Oh. Wash your hands. Okay. Okay, now that we've washed our hands, now we're going to gather supplies, okay? The next, number 2 on your list is to gather supplies. And those supplies are going to be your IV fluids, your primary tubing, your 2 catheters. You always want to make sure you bring 2 just in case you need an extra one, so you don't want to be running up and down the hall. Your saline lock, and we'll talk about that. I call it a J-loop. A microbore extension is what it has on your list. A towel, which hopefully will be in the room, and an IV start kit. Now I've gathered my supplies, okay? I have my IV start kit, and we'll talk about what's in our IV start kit. There should be a tourniquet, and there should be a tegaderm in there. There's some gloves and something to clean your site with, and some tape, and that's all that's going to be inside of your IV start kit. Okay, some facilities have IV start kits and some don't, and you have to get your own materials for that. So you need to go through that and make sure you have all the things that you need. Then we have a variety of angiocaths. That's what these things are called. They're the needle and the plastic part that actually goes inside the vein. So you'll notice that they have different colors, and these are universal colors. Everybody uses these, and they're always the same color. So a gray, this gray one, is a 14 gauge, okay? So anytime you pick up a gray, you'll be 14, okay? But remember, this is kind of like we compare it to a shotgun. The bigger they get, the smaller they are, okay? So then we go up to an 18, which is smaller than a 14, okay? So, and it's always going to be green. These are used usually in trauma situations, okay? We don't use these too often in people that we're just going to do that are just inpatients in the hospital. So just remember that these are large, and they hurt a lot more when you put them in. Then we have, most of the time, this is what we use, is a 20 gauge, okay? It's a pink, it's always going to be pink. 22 gauge is blue, it's always going to be blue. 24, we use these on, pediatric patients and young people or very old people that have unstable veins that are hard to hit. 24 gauge, okay? For our sake today, we're going to use a 22 gauge. So 22 gauge. 22 gauge is blue, okay? So anytime you see the hub of blue, you know that it's 22 gauge, okay? The hub of pink is 20 gauge, and so on. The hub of green, of yellow, is 24 gauge, okay? So just remember, if you look at the hub and whatever color it is, that's whatever gauge it is, okay? So just remember that. Also, we'll open this one and I'll show you how these work. If I can get it open. They come like this, okay? You see? Can you see that?
Hold on, let's take a look.
Okay. All right. And you take the top off, and you see that it's, it has, can you zoom into it?
Mm-hmm.
You notice that the tip of it is beveled, okay? And we'll talk about that bevel, because when we insert it, we're going to make sure that bevel is up, okay? It also has a little plastic thing here where you hold it and stabilize it. You're going to hold it with your thumb and your middle finger. That way you can have this finger clear when you need to insert the plastic into the vein, and we'll talk about that when we do that. Okay, it'll go in at a 10 to 15 degree angle. You'll get blood return, and then you'll advance that plastic part of the angiocath into the patient. Okay, and then you'll remove the needle, and at the same time it'll be coming back into the back so that you don't stick yourself. Okay, we don't ever recap needles, but since we haven't used this one, I'm going to put it back and we'll use it again. Okay, this is called a microbore extension. I call it a J-loop, so that's what it's been called. You know, my generation of nurses call these J-loops because they actually make a J when you put it in somebody's arm. Okay, so this is what's going to be filled with fluid, and I'll show you how to do that. And this part of it is going to actually attach to the catheter that you've put in the person's arm. Okay, the patient's arm. So there you go, and it has a little lock on it that you can lock it off and keep blood from backing up into it. And this is needleless, so we don't put any needles inside these ports. We just connect a flush to it, and I'll show you how to do that. Okay. Then we have tubing. This tubing is just you know, to let fluid run in. So it has no regulation that you would actually put in the pump, but most of them now have a port on them that slides into the pump and allows it to be regulated by the pump. How do you do this? Well, maybe I might get it open. So just so you know, all of your tubing will have an on-off. Okay, it's like this is the roller clamp, and you roll it down, and when it's like this, that means that it's clamped off. No fluid will go through it. And so before you attach it to any fluid, you want to make sure that your roller clamp is off. Okay, and this is your the actual chamber where you're going to spike the bag with. So you'll see that this has a port on it that goes actually pointed, that goes into the bag. We want to make sure that we keep this sterile, because this is a sterile technique. It will actually go into a sterile bag of fluid. Okay. And this is your fluid. And fluids come in many, many varieties. Is that too loud? Many, many varieties of fluid. Normal saline is what our order was, and this is normal saline. It's 0.9% normal sodium chloride, which is considered to be normal saline. You'll make sure that the fluid is clear, that the expiration date it's not expired, and there's no precipitant in there or it's not leaking. Okay, so we don't want anything that's leaking.